Hello everyone, welcome to today's live presentation. Today I am going to speak about an interesting topic and that is about ImmuLIT treatment and what is so special about this ImmuLIT treatment. Now ImmuLIT is a specialized therapy of Dr. Raut's Center for Reproductive Immunology and it is designed to address immune related causes of repeated IVF failures, repeated miscarriages and unexplained infertility. I am Dr. Mohan Raut. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut's Centers for Reproductive Immunology in Mumbai and in many other parts of India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and even unexplained infertility using our patented and branded process of lymphocyte immunization therapy, that is ImmuLIT, and other immunomodulatory treatments. So, to understand the need for ImmuLIT procedure in IVF failures or in miscarriages, we should first understand why IVF fails, and especially repeatedly, even when good embryos are there. Even when embryos are genetically healthy, implantation may fail due to immune tolerance issues and embryo implantation issues. For pregnancy to succeed, as you all know, the maternal immune system must accept the embryo as part of the body rather than reject it as foreign. This happens due to protective antibodies. If this tolerance fails, the immune system may attack or block implantation, even when embryos are genetically absolutely healthy. This hidden rejection is a common cause behind repeated IVF failures. A healthy balance of cytokines supports embryo attachment and growth, while an imbalance can create a hostile uterine environment. Too much or too little signaling can disrupt implantation, preventing pregnancy despite of good embryos. Now, beyond tolerance and cytokines, other immune responses also can interfere with implantation. Like overactive natural killer cells or NK cells may mistakenly attack the embryo, while certain autoimmune reactions also can damage uterine environment. These factors often go undetected in routine fertility tests, leaving the couples with unexplained IVF failures or unexplained miscarriages. So, this is where advanced reproductive immunology treatments like ImmuLIT come into play. So, coming to today's topic now, what is ImmuLIT? ImmuLIT is, as I mentioned, a type of lymphocyte immunization therapy which is useful for reproductive failures, and it is a specialized treatment of Dr. Raut's Center for Reproductive Immunology, and it is designed in patients who have unexplained repeated IVF failures or miscarriages. While conventional fertility treatment often focuses primarily on embryo quality, ImmuLIT evaluates the maternal immune environment that plays a critical role in implantation success. Through advanced reproductive immunology assessments, it identifies hidden factors such as cytokine imbalance, impaired immune tolerance, or overactive natural killer cells, absence of blocking antibodies, so which can prevent implantation even when embryos are of good quality. Immunite acts by stimulating the production of protective or blocking antibodies and activating regulatory immune cells, particularly the T regulatory cells, which help create an immune environment similar to the natural protection of pregnancy. So, this immune balance supports implantation rather than rejection of the embryo. So, ImmuLIT uses detailed immune profiling to personalize the treatment according to each patient's immune response, and thus offering couples who have repeated IVF failures a targeted and scientifically grounded treatment option. Now, the question that is often asked to us, and it's very interesting, that is ImmuLIT a type of LIT? Is ImmuLIT different from regular LIT? What are the benefits of ImmuLIT against regular LIT? So we can consider five aspects here to understand this: the diagnostic depth, the personalization, focus on implantation, suitability, and the innovation. So the first is diagnosis or diagnostic depth. LIT provides a broad, generalized immune boost without detailed profiling, while ImmuLIT it offers precision diagnostics, mapping the immune responses at a deeper level to identify subtle imbalances such as cytokine balance and pregnancy success issues. The second factor is personalization, very important. LIT has standardized approach, same protocol applied to most patients, while ImmuLIT delivers personalized therapy, adapting treatment to each patient's unique immune tolerance and cytokine profile. Third factor is focus on implantation. In case of LIT, indirect support for implantation is limited to addressing hidden immune barriers, while ImmuLIT directly enhances implantation potential by resorting to immune balance, improving chances of embryo acceptance and pregnancy success. The fourth factor is suitability. LIT can benefit some patients but lacks targeted solutions for complex cases, while ImmuLIT is specifically designed for recurrent implantation failure, making it a breakthrough among treatment options after repeated IVF failures. And fifth, most important, innovation level. LIT is a conventional therapy with limited scope, while ImmuLIT represents advanced reproductive immunology treatment offering distinct advantages over traditional methods. So, what is the advantage of Dr. Raut's Center for Reproductive Immunology and doing ImmuLIT there? The couples who experience recurrent implantation failure or miscarriages, despite normal embryos or pregnancies, often face frustration when standard IVF protocols provide no clear answers. In many of these cases, hidden immune factors such as disrupted tolerance or cytokine imbalance are the underlying causes. And for patients with unexplained infertility after multiple IVF failures, immunotherapy for IVF of these failures offers advanced immune profiling to uncover these barriers and provide actionable insights that conventional testing may overlook. So, at the same time, ImmuLIT for recurrent implantation failure is ideal for those who are seeking advanced reproductive immunology treatments that go beyond traditional approaches. So, by tailoring the therapy to each patient's unique immune environment, ImmuLIT delivers targeted solutions that restore balance and improve implantation potential. This makes it a breakthrough among the treatment options after repeated IVF failures, offering couples renewed confidence and a more personalized path, I can say, towards pregnancy success. And what more? Immunity is done by Dr. Mohan Raut and Dr. Mugdha Raut themselves, who are internationally qualified clinical reproductive immunologists. So, friends, in conclusion, repeated IVF failures can be one of the most difficult experiences for couples, especially when embryos are genetically healthy, yet implantation still does not occur. The missing piece often lies in the immune system, in how the body establishes tolerance, balances the cytokine signals, and manages the hidden immune factors such as natural killer cell activity. Recognizing these complexities is absolutely essential to moving towards conventional, I can say beyond conventional approaches and addressing the true reason behind recurrent implantation failure. And this is where immune therapy for IVF failure or miscarriages offers a breakthrough. By combining precision immune profiling with personalized treatment, it restores the balance and creates receptive environment for embryo implantation and for pregnancy. For couples asking why does IVF fail repeatedly even with good embryos, ImmuLIT provides scientifically driven answers and actionable solutions. So with ICPRM's expertise in advanced reproductive immunology treatments, ImmuLIT represents not just another attempt but a renewed path towards parenthood which is built on clarity, confidence, and hope. So please share this information to those who are suffering with the problems of miscarriages or IVF failures or even unexplained infertility. You will definitely change the life of at least one couple. Please send your queries. I will address also them right now. I think there are already a few questions. What is so special, or that's what they ask, what is different with immune? Now, as I mentioned in my talk, ImmuLIT is a type of lymphocyte immunization therapy, but it is a more advanced form, more research form. So it is a patented process. The process of cell separation, the cell count that is injected into the patient are all researched, and they are part of the patent. And all this gives excellent success rates. Here, I would like to mention one thing, that this ImmuLIT procedure, the way we do it, it's a one-time 3-hour procedure. So we don't repeat the procedure anytime, and uh, the success rate which is seen associated with this is as close to almost 75 to 80%, because we select couples by the proper immunological investigations. Uh, how does it differ from LIT? That is fine. I just addressed. Is it? Do you repeat any investigations after immediate procedure? So here I would like to tell. I think this is very important. Many patients also ask us, doctor friends also ask us, the immunological mechanism by which this treatment acts. It is very important to understand, because immune system behaves in a particular way. Whenever there is any antigen which is presented to the immune system, they form memory cells. So similarly, when the pregnancy, when the lymphocyte immunization therapy is done, that is ImmuLIT is done, the way we do it, the lymphocyte antigen, the CD2 200 antigen is presented to the immune system, and immune cells, the T and B cells are formed. They are called as the T memory cells and B memory cells. And when these cells are exposed to pregnancy, the pregnancy cell surface also has similar CD200 antigen, which stimulates these memory cells, and they produce protective, B cells produce protective antibodies, T cells produce Treg cells. So therefore, we do not repeat these tests after the first injection, and after a stipulated period duration, that is after 4 to 8 weeks, we ask the couple to plan pregnancy, and during which time we expect the stimulation of these memory cells to produce protective antibodies and protective cells. So, friends, I think if you have any queries, you can always contact us on our helpline number +91 9833201522, or you can visit our website www.icprm.in, and do write to us with your queries, and we will see to it that we answer this personally to you. Thank you so much for attending this live presentation and listening to this interesting topic. We will come up with more interesting topics in our live presentations. If you would like us to cover any specific topic in live presentation, do write to us. We will cover that in our subsequent live presentations. Thank